When talking about mobility and stretching, do you subscribe? And you alluded to it being a neurological issue. Do you actually encourage people while they're in the stretch to have an isometric contraction while they're also in there, or do you not, and why or why not?
Yeah, I think you can definitely do that. For example, I love using like the world's greatest stretch. So you're in like a deep lunge stretch and driving that knee out to the side. So we're working a little bit of hip external rotation, flexion on one side. And in that position, sometimes sort of squeezing and contracting the muscle, that isometric contraction. I think what it can allow you to do is integrate what we would call muscle re-education. In teaching the body how to own that new movement. Because yes, you can push a joint to its end range of motion, but adding that muscle contraction in sort of allows you to then own that new movement capability. So yeah, it's a little bit of PNF at times if we're talking stretching, but when we're talking movement through mobility exercises, having that isometric contraction at the end range or through certain specific ranges, I think allows you to lock in that movement quality that much more so it bleeds over into your movement that you're going to do afterwards.
Yeah, it's the difference in between like passive flexibility and being able to own it and control it.
Exactly.
Are squats a fundamental human movement? I mean, from my perspective, I think squats are phenomenal. They're great performance, strength. They build incredible lower body. But you sometimes get the argument from people in our space that say that squats are not this fundamental movement. I know some strength coaches will say that they only do unilateral or split stance movements with their athletes. So is it a fundamental movement? Is it something that, that humans should practice often because it's as fundamental to us as, let's say, walking or standing upright?
Yeah. So I think you have to look at it two different ways. You said fundamental human movement, and then you talked about training.
Right.
Because those are two different things. So when we're talking fundamental human movements, yes, first and foremost, the squat is a fundamental movement because it's something that we learn as a growth and development milestone. If you watch a baby, it's going to crawl, then it gets into a squat pattern, and eventually to stand up. If you watch a baby pick something up, it is a way in which we as a young child learn to explore the world. We use the squat as a fundamental building block to eventually standing, walking, running, things like that. Now, when it comes down to training, I think Mike Boyle gets brought up in this a lot because he uses a lot of single leg movements, Bulgarian split squats, things like that, more so than the squat. But you have to understand when we're talking about training, we're looking first and foremost at what are the desired adaptations I want to bring out specifically for the sport at hand. If I'm training a weightlifter, a power lifter, a CrossFitter, yes, the squat is first and foremost an extremely important fundamental for that training, especially in the powerlifting because it's one of the three competition lifts. As a weightlifter, the squat is an assistant exercise that allows you to strengthen and reinforce the capacity to get in and out of the bottom position for a snatch and a clean and jerk. For a hockey player, is it always something that you're in a double leg symmetrical stance? Probably not. For a baseball player, I would say potentially, especially like a shortstop, third baseman getting down in a ready position. That's a squat. I think it sort of depends on the sport at hand. And when we're looking at sport specificity, we want to take into account what in the training room am I doing that's going to lead to better performance on the field? Do I need someone to squat 500 pounds ass to grass in the weight room if their sport is tennis? You know what I'm saying?
Yeah.
We want to be able to bring out the best adaptations. Now, do I think the squat should be something that should be trained by all? Yes. The way in which we squat then has to meet the individual's capabilities and end goals. So while a back squat is amazing and has to be a fundamental for a weightlifter or a power lifter, what's wrong with maybe a Zercher squat for someone else? Or maybe just like a kettlebell goblet squat? Because having a load in the front and showing capacity to show symmetrical, mobility through a full range of motion that person can perform, I think is a fundamental movement. Now, maybe we're only doing that once a week, and then we're doing Bulgarian split squats and single leg RDLs and single leg squats 3 out of the other lower leg days for that athlete if they're a hockey player. So again, I don't think it's something, I think there's a lot of it depends. And I think at the end of the day, it comes down to the individuality of what you're looking for. But I don't think there's a situation where I would ever say we completely cut out a double leg squat. But then understanding that who says a barbell back squat has to be performed by anyone, because you can squat in a lot of different ways. I just think we have to meet the individual at what goals that they need. Regardless of that, they should be able to perform a great quality looking body weight squat. Again, coming back to fundamental human movements first, and then as we go up the chain of how do we develop strength, how do we develop power, we can then base and change our things off that. But we have to, every single person should be able to perform a good quality looking body weight squat.
Yeah. Now, speaking to sports specificity, we've all seen kind of videos out there with LeBron James doing a quarter squat. And in general, can you justify a quarter squat, say, for a basketball player?
I think when you look at the research, there are some articles out there where they talked about quarter squatting as far as improvements in vertical leap performance as compared to a full depth squat. I can't remember the article offhand, and I haven't read it in years. It's stashed away, but I do believe that there are some research articles that have shown that. Now, here's the deal when it comes to that again, is a lot of times people will take like one research article and then they'll just run with it. Just like sort of split squats or full depth squats with a barbell on your back. What's to say for a basketball player, I can't do both? If LeBron James feels like he gets benefit from doing a quarter squat in his vertical leap performance, what's wrong with doing quarter squats one day of the week and then having him do a maybe full depth goblet squat the other day of the week? Again, I think there's not a right or wrong. There's an it depends. And I think when you come out and you make big, large black and white statements like, I would never quarter squat. Well, then why is there an article saying that it did help some people show better vertical jump performance? I think you have to understand what's our end goal. Am I going to have a powerlifter quarter squat? Probably not. But, who's to say that box squats or, pin squats from different heights aren't also helpful. So I think there's a lot of it depends, and variability is the name of the game at certain points in your training career.
Speaking of the squat, is there an easy way for somebody to find or figure out the ideal squat stance for themselves? Like, is there an easy test that they can do where they can find where they should place their feet, if it's a little wider, a little more narrow, feet out, feet in, or is it just trial and error?
So there's a lot of it that's trial and error, but there's a lot of science that we can bring into it. And I actually made two recent YouTube videos. So if anyone listening just goes on Squat University YouTube and types in how to squat for your anatomy, the first one was talking about understanding toe angle. Now, like I said, I think a lot of people haven't reached their max potential mobility-wise. So this is only a small glimpse into the potential way in which you should be pointing your toes. And that's looking at anteversion versus retroversion. And basically what we do is we have someone look at their internal rotation and external rotation in both a seated and on their stomach position. So in a seated position, your hips flex to around 90 degrees. And we look at internal and external. And then on your stomach, your hips fully extended. So at a 0 degree extension. And then again, we look at hip internal rotation and extension. Now, if someone shows limited internal rotation and excessive external rotation in both positions, we can say that likely they have a degree of retroversion. So their hip socket and the way the femur attaches is retroverted. So it's more of a flat angle. That person is likely going to have a greater ease at squatting deep with their toes turned out to a greater degree. Now, to what degree? Obviously, there's going to be a lot of variability, but more so than probably 15 degrees. For someone that has excessive internal rotation and very limited external in both a seated and a prone, so on their stomach position, we can say that they likely have a good degree of anteversion, meaning that their hip socket alignment with the femur is more angled compared to a retroverted position, meaning those are the people that usually can squat with their toes 100% straight forward. Now, again, this is only a glimpse into the potential anatomy contributions, because here's the deal. Some people could have a crazy amount of retroversion or anteversion at their hip, and as they grow and develop, they develop a twist, a torsion in their tibias, their lower leg bone, to hide the fact that they have a specific twist at their hips.
Interesting.
So it's not 100% this way or that way, but it gives you an understanding, because some people are like, man, I just cannot squat with my toes forward. Every time I do, I just get this huge block sensation in the front of my hip. And then they do this test. They're like, wow, I'm really retroverted. I literally have no anterior or internal rotation. And then they turn their toes out and they're like, I can finally squat full depth. Well, that doesn't say, that you are never going to do internal rotation mobility work, because you probably haven't reached your end potential with that. But if you actually turn your toes out and allow yourself to accommodate for what your body's mobility needs, it may allow you to move better, and that's going to allow you to have less increased injury risk, and it's going to allow you to potentially unlock future performance. So that's sort of toe angle, but there's other ways too. What were you going to say?
Oh, I was going to ask the question of how you did those. So you said seated and on your stomach. So if I'm sitting down, do I have my knees bent in 90 degrees, and then am I rotate? So essentially, for the listener who doesn't know external internal rotation, I'm turning my foot out and then turning it in.
Yes.
And when I'm on my stomach, my legs totally straight out. I'm doing the same thing, turning my foot out, turning it in, and then.
So on your stomach, your knee will be bent still, and you'll let your foot come in and out.
Got it. Okay, perfect. All right, continue. Sorry.
Yep. So that's just sort of the toe angle based on retroversion or anteversion. Now, another thing you can do is you can lay someone on their back, and you can either do it by yourself or have a friend, but you can bring their knee towards their chest and see how far can you go before they sort of run out of end range of motion and either get a pinch sensation or just the femur just stops moving forward. And then have them go out to the side a little bit. And some people will be able to get their knee all the way to their chest. That's what I can do. Like, I can literally have my knee touch my chest. Some people, they'll sort of get a block sensation. They may get to like 90 degrees. But yet if I take their femur and go sort of towards their maybe their biceps, so I bring them out at an angle, they can get their knee further toward their shoulder so they can get more hip flexion. Well, that's showing that person that a slightly wider stance can allow them greater hip flexion, greater depth of their squat. So again, it's sort of a lot of trial and error, but there's a few different tests in which we can do to give ourselves a little bit of an insight into what stance may bring out the most optimal squat depth and sort of position for our feet.
What are some of the fundamental differences between correctional exercise and exercise to build strength and muscle? For example, I'm doing a cable row because I want to develop my back, or I'm doing a cable row because I'm trying to, fix forward shoulder. Like, what are the fundamental differences between the application of this is how you apply corrective exercise, this is how you apply exercise to improve performance and build muscle?
I would say probably the few big differences are, first, the load at which we're using and the tempo at which we're going about. Now, not to say that you can't use tempo work for regular strength building, but especially when we're looking at corrective exercise for improving strength and stability, I think that's a big disclaimer that a lot of people don't realize. Strength is your ability to produce force, to create movement. Stability is your ability to limit excessive or unwanted motion. Just because someone is strong doesn't mean someone has good stability. And this points back to a lot of research where they've taken people at their core and they've sort of trained them different ways. They've had them do dynamic movements of like sit-ups, Russian twists, things like that, things that build strength within the core abdominal muscles. And then other research same research study, different group, where they had them do isometrics. So this would be like the McGill Big 3, modified curl up, side planks, things like that, things that aim to improve endurance of the muscles, but to limit any spinal movement. And then they would test them after performing. And they found that those who had done the stability protocol of the planks, things like that, they had better ability to limit excessive motion in the spine when they were put on the specific training regimen. So it shows that sometimes, especially at different parts of the body, like the shoulders and the hips, if we're looking to improve strength, we're going to have usually faster tempos comparatively, and we're going to be using more load because of, we have to have progressive resistance exercise to be able to show more and more strength. Whereas stability exercises, usually we're going to be going much slower because I want that person to feel for the problems, for the waverness in their technique. I want to put them sometimes into positions where they have very little base of support. So like a single leg RDL is a great stability exercise. And I would double that with a double leg RDL to improve strength. but sort of they work together. So you talked about like a single arm row. Or just a row in general. If I'm having someone do a row for strengthening their back, I'm going to be probably having them do between usually 10 to 8 to 5 reps with progressive load. But if I'm having someone that maybe just has poor stability of their mid-back muscles, the rhomboids aren't kicking on well, posterior shoulder musculature isn't kicking on well, so they have poor posterior strength, imbalance compared to the front side of their body, which is a common reason for some people developing shoulder pain, I would maybe have them do that same row, but with less weight. And in that final position, they're pinching that pencil between the shoulder blade, they're getting that good retraction, and I'm having them hold for 5 seconds, getting that brain-body connection, and then a slow tempo back. So I'm allowing them to really realize how that muscle should work, to limit the excessive motion at that particular joint or joint complex, to allow them to sort of build that ability to limit motion, control that area, which is then going to be a little bit different when we're talking strength and power, because we're going to be adding more load, doing less reps usually.
Okay, so essentially you're going to go lighter, a little slower, and you're going to focus on the contraction, the squeeze, or the connection. You would say, is that
Exactly.
summarize a little bit? All right, perfect. Now,
Yeah.
some of the I used to own a personal training studio, and I had a physical therapist that worked in there, and I learned so much about correctional exercise from watching her. I learned so much. It was a great experience. She learned a lot from me in terms of strength and performance, because that was my background. You have both, right? Your background is physical therapy, but you talk a lot about performance and strength as well. What irks you the most about the physical therapy space now that you do both? What are some of the challenges you see? Do you ever have clients that come to you from other physical therapists, and then you're applying now your performance knowledge to kind of take it to the next level? Like, what are some of the challenges with that space?
Physical therapists hate to load the body. They have no idea across the board how to actually lift some big weights. So like, you walk into any physical therapy clinic across the US and you'll see tiny little dumbbells up to 10 pounds. You'll see a lot of TheraBands. You may see some kettlebells, but they're probably not over 15, 20 pounds. In my physical therapy clinic, if I were to show you around right now, I've got 5 barbells, a transformer bar, a Mars bar, a squat rack that's 5 feet away from our bed, kettlebells up to 50 pounds. It's the idea that, functional fitness stops at 10 pounds, and you can't treat an athlete or just a person in general, because the next time they go to pick a box up in their garage, that's more than that 5-pound kettlebell you had them do. Like, I think across the board, because physical therapy in general for a long time treated very debilitated people that are injured that can't lift heavy, we didn't realize that there's this spectrum that once we get them out of pain, we have to then continue the cycle of getting them back to performance or back to strength, back to functional levels. And that requires load. That requires you to put someone in a position where they have to be challenged. And you can't do that with, small little bands. I think it's something that the physical therapy profession could learn a lot from the strength and conditioning profession.
Yeah, I asked that question because I actually had a lot of clients who did physical therapy, and then they'd come to me and they're like, "Oh my gosh, I feel so much better." And I remember communicating this to the therapist that I worked with, and it was great. It was a wonderful relationship where we learned from each other. So that's why I asked you, knowing that you have both backgrounds, what the big differences are. So for the average person who goes to physical therapy because they have a bad back, and then they work with the normal, your average, typical, stereotypical physical therapist, they get their range of motion, they get their stability. What's the benefit then, to get a little bit, more specific? What's the benefit then from there to go from there to then building some strength and working out more traditionally?
I think the big thing a lot of people don't realize is that even though they have gotten out of pain, that doesn't mean that they are back to their prior level yet. Because what happens is that when you have an injury, it really cuts down on your strength, on your power, on your performance. And it doesn't take a very skilled individual sometimes to get someone out of pain. You can do that by just removing the injury stimulus. So if bending forward hurts you, we stop bending forward, we remove the flexion intolerance, we build back some stability, but then what happens is that a lot of times I get clients that are like, well, I got out of pain and then I went back to doing what I was doing, and then my back pain came back. Well, it's because we ignored the idea of capacity. And capacity is your strength and your ability to stay resilient under load or just in different situations, speed, power, however you're pushing your body. So while you may be able to build up some genuine core stability that's authentic for the load that you're putting yourself into, and you improve your mobility, if you don't improve capacity, so your ability to withstand load and maintain postures and positions, the next time you go out to train heavy or pick up a heavy box in your garage, it's going to be putting you in a situation where you could potentially find injury again. So that's that sort of in-between gray space, I think, that a lot of people ignore, in an area in which we can get, I think we can improve upon a lot in both the physical therapy profession or also the strength and conditioning coaches who are seeing athletes sort of get kicked out of physical therapy early, having a better awareness of how they can build capacity, because that person that used to squat 500 pounds comes back to you and they're not squatting 500 pounds anymore. They're pain-free now, but if you put 500 pounds in their back, they're going to crumple. Well, how can I still continue along that transitional line to build back strength and build back stability and capacity so that they can enter a normal strength and conditioning program again?
Excellent. Okay, so another question with in terms of helping with pain, and what role does controlling inflammation play with this? I mean, I know that in the past we were told to really eliminate inflammation, use ice, and take non-steroidal anti-inflammatories. Later on, we learned that inflammation plays a crucial role in signaling the body to repair. You work with a lot of people, athletes, people who have pain and have injured themselves. How do you coach them through the use of anti-inflammatory, either drugs or ice, or is it something that you even need to manage? Is it just movement-based?
I think there's a lot of it depends, because inflammation is not good, nor is it bad. That's a big thing we need to understand here. Inflammation is normal. It's a normal part of the injury cycle. If you ask any medical professional, what are the 3 stages of injury? You have inflammation, repair, remodel. If you don't have inflammation, your body will not optimally repair and remodel the injury. So to say, well, every single person just needs to take, these anti-inflammatories and ice to control inflammation, you're actually delaying the injury process. There's a lot of research that shows that those who ice excessively after an injury actually delay the healing process. And it actually, so a lot of people will use the RICE protocol: rest, ice, compress, elevate. And that was from Dr. Gabe Merkin, who in 1978 created the RICE protocol. Well, actually, he came out in 2013, I believe, and actually recanted his statement, saying that ice actually hinders the healing process. And we know much more now than we did back then, that it actually delays and hinders the optimal healing of any type of soft tissue injury. So what we want to do is not stop inflammation, but understand it. And that by improving our movement within a pain-free zone can actually bring more blood flow to an area, allow proper healing to take place, but not continue the injury cycle. Now, there are going to be some people that are just, they're so painful, it's not allowing them to do any type of movement. For those people, sometimes, cortisone shots in anti-inflammatory medications do have a place. So I'm not going to say that they're never a positive situation. But for most people, what I find is that pain-free movement, using things like a neuromuscular stimulation device like the Mark Pro, the Power Dot, Compex, things like that, that can help bring more blood flow into an injured area and remove the injured debris that happens from any type of soft tissue injury or just heavy, intense training, will allow the most optimal situation for healing from anything without trying to stop inflammation. So if I could say one thing is to people out there, it's inflammation is not a bad thing. It's just a part of the injury cycle. And we need to try to optimize the healing process as much as possible, not just try to stop it, which is the same thing with swelling.